but we should be feeling this intensely. We should all be carrying the weight of the kids who are hurting around us.
They are the faces behind countless stories of demanding and difficult work at Seattle Children's Hospital.
I could quit and work at a job where I'm not getting hit or bit at or screamed at, but I want to do that because that's what these kids have experienced. I'm here to help them.
These nurses detailing at a candlelight vigil how the short-staffed psychiatry and behavioral medicine unit struggles to provide quality care for their most vulnerable patients who often become violent. It's led some passionate people like Lexi Webster to quit in late 2021.
For fear that myself or a patient would die due to lack of desperately needed resources. I left the PBMU after watching 6 horrendous assaults without adequate resources to respond.
The nurses union is calling for help from hospital leadership and the state for extra staff, boosted safety measures, and more.
We also want that if our staff are being mandatoried, if they're being told you have to stay past your scheduled time, they should be getting double pay because they're being forced to be in an unsafe environment and they're being told they can't leave.
These nurses say they'll keep fighting for more supports for their patients.
I love the kids that I work with. They embody resiliency.
It's why Webster ultimately returned to the hospital earlier this year with hope for systemic change.
The acuity and aggression that we're seeing now has only increased since December of 2021. It's worse, and it is a direct result of the hospital not acknowledging this as a problem 2 years ago.
In response to tonight's event and nurses' demands, a hospital spokesperson in an emailed statement writes that they have since added some extra security measures and staff. Those contract negotiations are ongoing between the hospital and the nurses union, with their next meeting set for tomorrow. For now, live in Seattle, Jackie Kent, KOMO News.
There's great danger anytime personal information ends up in the hands of cyber criminals. This time, a data breach at the Fred Hutchinson Cancer Center is followed by ransom notes to Hutch patients, but also to victims who have never even been a patient here. Case in point, Jack Doe, the child at the center of a new class action lawsuit. At just 2 weeks of age, the suit says he had a follow-up appointment at the UW-Medicine Northgate Clinic. Now his dad reports getting extortionary messages like this one Nick Quinlan got.
I could remove it from the dark web by paying them $50 in Bitcoin.
Jack Doe was never a patient at Fred Hutch, so how did he become a target? Susan Gregg with UW-Medicine tells me the two health systems work together advancing cancer research. And she said the data breach at the Hutch impacted data for some UW patients who have not been seen at the Fred Hutch.
I think that a lot of critical infrastructure in organizations such as hospitals are no exception, are going to be very prime targets for these kind of people.
Right now, the Washington Attorney General's website lists 10 other data breaches involving medical information, all reported in just 60 days. And this list does not include the newest breach at the Hutch. These types of cybersecurity threats the FBI calls one-stop shopping for criminals. So what is the Hutch doing about all of this now? They said they quarantined computer servers, alerted federal investigators, and hired a cybersecurity firm. I also asked just how many people may have been victimized in this data breach, and they told me they are still conducting their forensic investigation to learn that number. In Seattle, Denise Whitaker, KOMO News.